Hey guys, welcome to the Road to Wellness podcast. I'm Brad Pitzele. Today we have a very special guest, Dr. Ravi Kumar. He's a board-certified neurosurgeon specializing in brain tumors, neuro-oncology, and complex spine procedures. He completed his residency at the Mayo Clinic School of Graduate Medical Education and is also an assistant professor at the University of North Carolina. He's a neurosurgeon, a researcher, and an explorer of human health, and he hosts his own podcast, the Dr. Kumar Discovery. You guys got to check it out. And on that podcast, he discussed topics such as neuroscience, longevity, and holistic health. With a background in conventional medicine and a passion for holistic healing, he seeks to uncover the most effective approaches to optimizing human potential. His journey has taken him around the world, from medical work in India to modern surgical wards in laboratories in the United States. Please welcome Dr. Ravi Kumar. Well, thank you for joining us today, Ravi.
Yeah, it's my pleasure, Brad. Thanks for having me.
You bet. So, I find it really interesting. How did you get into neurosurgery?
Well, I went to medical school thinking I was going to be an orthopedic surgeon because, I had watched the videos online and they were really cool. Orthopedic surgeons in there hammering like big nails down people's, long bones. And I thought, oh, that looks really cool. And early in medical school, I met a neurosurgeon who kind of took me under his wing, and I totally fell in love with the central nervous system. And so neurosurgery is surgery on the brain, spine, and the peripheral nerves. And that's what I do. And it's a super interesting field with very delicate anatomy, but some of the most functional anatomy in your whole body. And I went into it, and it's like 7 years of residency and then a big learning curve even after you get out of residency. And I've really loved it. It's a stressful field, I'll say that much, because, when you help someone, it's awesome. And most of the time you do. But when you make a small millimeter mistake, movement in your hand or a judgment, patients get really hurt badly. The central nervous system is pretty unforgiving in a physical aspect. So, but that being said, I'm glad I'm a neurosurgeon. I enjoy it.
Wow. That's amazing. And what sorts of surgery do you do?
So I operate on the brain a lot. I do a lot of brain tumor resections. So people come in with metastatic brain tumors, primary brain tumors like gliomas, meningiomas. I operate on those. And then I do a lot of surgery on the spine as well. People's spines are degenerating through their life because of a whole host of factors like inflammation and metabolic, basically sickness, and smoking is a big one. Obesity is a big one. And these all break down the axis of your body, which is your spine. And so when that happens, people get pain or lose function. And so I step in with surgery and try to fix them as a last resort. Wow. So that's basically majority of what I do.
So, but you kind of straddle the world, because obviously you're a neurosurgeon doing traditional medical therapies and cutting edge medical therapies, if you will. But you also are very interested in holistic health. How did you get into that?
Yeah, because I think, everyone kind of finds their path in this world based on their own struggles. Yep. I know you did, and yeah. You were on my podcast and we talked all about it. And it's a fascinating story. I had something similar, after residency, I just got really sick and I couldn't figure it out. And all my colleagues who were my physicians who were my doctors too. They couldn't figure it out. And really, they didn't have the patience or the time to really sit there and help me figure it out. You see your doctor for 15 minutes, right? And if it doesn't fit in that standard brochure of pharmaceutical, drugs in their catalog, it's on to the next thing. Because sitting there and critically thinking deep into a patient's problem is very difficult. It's very time consuming. And so I ended up self-doctoring, and that is extraordinarily hard to doctor yourself. And I started asking a lot of questions and learning a lot of things that were not taught in medical school. And that's kind of what guided me into this it opened my mind. I mean, before that, I was still a very tunnel visioned, conventionally trained physician. And when I got sick and had to figure out my own problems, my mind just blossomed into this whole world of figuring out what causes problems and solving the problem there. Not that treating symptoms with conventional medicine, which is what I do, is a problem, but man, if you can fix the root cause of a problem, if you can pull the plug out of a sink that's overflowing, you don't have to wipe the water off the floor anymore. And so that's kind of how I ended up at, yeah.
And what was some of the biggest eye-opening moments for you as you went through that kind of transformation?
Yeah, I mean, well, this is the biggest problem I see, is that all these diseases of modern society, they really didn't exist in any meaningful way before the Industrial Revolution, before the Agricultural Revolution. I mean, people died back then of infections. That was a leading cause of human mortality. And now we don't have, infections are very low because we have antibiotics and antiretrovirals and, you know, all sorts of antifungals to treat infections. But now we die of these chronic diseases, heart disease, you know, metabolic disease from diabetes and energy utilization. We suffer from severe osteoarthritis that basically inhibits our ability to move through the world without pain. All these things just, in neurodegenerative disease, that's a big one, you know, these things just didn't exist before. And when I saw that, I was like, well, why? And it all comes down to these actually pretty simple reasons, and that are fully addressable through diet and lifestyle, honestly. I mean, I don't want to be the person who says diet and lifestyle is the only medicine you need, because if you're in a hole, that's not the truth. Yeah. But diet and lifestyle are probably the root of every chronic modern degenerative disease.
And it doesn't help all the things we're putting inside the food supply and all the chemicals that are out there toxifying our world. So it's a harder and harder role if you're the immune system or you're the lymphatic system trying to get stuff out of the body when we keep flooding it, isn't it?
Yeah. I mean, a perfect example of that is, it's in the news right now, is, you know, the president of the United States signed a war production act or executive order to increase the amount of glyphosate production in the US. And, you know, glyphosate is Roundup. It's it's a herbicide. And it's UC Berkeley, King's College of London, the Ramazzini Institute, I mean, the WHO are all like, yeah, it's a probable carcinogen. It's an endocrine disruptor. It's a gut microbiome disruptor because it was originally developed as an antibiotic. It's bad for you.
Yeah.
And it's been pretty solidly shown to cause non-Hodgkin's lymphoma. Yeah. And the company that makes it has had to pay out $10 billion in claims to people who've got non-Hodgkin's lymphoma, and they were going to shut down glyphosate production because it was so expensive. The liability was so huge, but now they have, basically through this executive action, they have the ability to not have liability for the.
Wow.
Yeah. Yeah. Now, just the glyphosate's on pretty much everything that's non-conventional, like, you know, pinto beans, garbanzos, wheat, oats, because even if it's a non-GMO crop, that because that's how they use it. They create these genetically modified crops that resist Roundup. Roundup kills all the weeds around them.
Yep.
But with the non-GMO crops, when they're ready to harvest it, they want to wait for the sunshine to come out and dry the crop out. So what they do is they spray the whole field with glyphosate. It desiccates the crop, and then they harvest the grains, the beans, whatever it is. And those seeds are laden with glyphosate, way more than if they had sprayed early in the season for a GMO crop. And then we feed it to our kids, you know, and their cereal and their, you know, their beans, or you think you're giving them nice, healthy whole wheat bread, and it's full of glyphosate. So yeah, you're right. Chemicals are all over in our food. And if we don't know about it, we don't know how to avoid it.
And what's the link between that and like brain health?
Well, so it is a endocrine disruptor. And so it gets at the basic functions of metabolic health. Yeah. Because, you know, without adequate microbiome health, without adequate hormonal health, you can't be metabolically healthy. That's often why, you know, women who go into menopause and men who are have low T, their metabolic health tanks as soon as those hormone levels are low. You know, hormones are essentially what keep us young. And so when your metabolic health tanks, then your neurological health tanks. Because Metabolic health affects the vascular flow to your brain. It affects the inflammation in your brain. It affects the mitochondrial efficiency in your brain. There's just so many. It's linked to every natural process in your body. And so
Yeah.
you throw a monkey wrench in those gears, things stop working properly.
It's really kind of fascinating. I hate to say that because it kind of sounds clinical. I have a lot of empathy for people going through it, but it's fascinating how many of these diseases are related to vascular and mitochondrial issues. You see that in Alzheimer's, we talk about it a lot. We talk about it obviously in diabetes. We talk about it in cancers. We talk about it in just about it's amazing how much research has come out in the last 10 years to link mitochondrial health and vascular health directly to so many chronic health conditions.
Yeah. I mean, if you can't make energy properly,
Yep.
The cell becomes unhealthy. It degrades from poor energy utilization, oxidative damage, and you end up in a state of basically starvation all over your body because your mitochondria are not making the ATP efficiently for you to use in your cells.
And when you were working on getting through your biggest health challenge, what sort of things did you use in the holistic arena?
Yeah, I mean, I was all over the place. I mean, just like you were,
Yeah, I
and
was too. I can relate.
I mean, that's what you do when you don't have an answer, and it honestly, of all the people, out there who are struggling with something, that we end up self-treating because we feel like abandoned by the conventional medical community. And so we end up trying things, self-experimenting, and it's very hard to be objective in that situation when it's your own body,
Yeah. Yep.
And so you end up trying a bunch of stuff because you can't think critically about the problem, or you can, but it's very hard.
Yes.
And so I was all over the place. I was on all sorts of different diets. I was vegan diet, carnivore diet, paleo diet. I was on a Mediterranean diet. I was trying, the supplements, and that is a supplementomania. I mean, that is a big problem, because you don't know what's working. You try something, you're like, maybe it's working, and then there's definitely a psychosomatic, a placebo effect with these so you end up, next thing you know, you're on 20 supplements.
Yep.
And your medicine cabinet is full of 100 of them,
Yeah.
and you've spent 10% of your income that year on supplements. And so I was all over the place. What eventually got me really, and you're gonna laugh when I say this, but there was no supplement that really got me out of the situation I was in. It was a complete life reset that I did. We sold everything we owned. I quit my job, and my wife and I moved with our 4 children and our dog to India. And I just took a year of sabbatical. And I was still working in the mission hospital there for free, just giving my services to people in need. But it was low pressure. It was a grateful environment. I had none of the pressures I had in the United States. And it was kind of like hitting that big reset button.
Wow.
And that just taught me how massive of effect chronic stress has on your body. It affects every system, from inflammation to energy production to sleep. It's all affected by stress. And when you hit that reset button, guess what? Your body wants to heal. It has a natural, amazing capacity to heal. And if you let it, it actually happens. But if I kept working 90 hours a week, under, dealing with very complex problems, poor treatment from the hospitals, no reliable partnerships, and in practice, I was just going to continue suffering. And so I just let it all go, and I took a year off.
That's amazing.
And it fixed me. And then I came back and I was fine. After
And
a year, I came back from India to the United States, and I'm in practice. I'm a assistant professor at UNC now, and it's fantastic.
That's amazing. And I imagine those probably several components, as I kind of heard it. Like we were talking about all the pollutants and toxins here. Perhaps there was a difference in environment there. spiritually, just being in a place where people are grateful and you don't have the stress to perform. There's so much to be said about the body, spirit, and the healing, right? And like
Yeah.
feeling positive about your life and where it's going. I know for me, a change of mindset was really big in my healing journey.
Yeah. I mean, I'm not telling people to, if they're sick, give up and move to India, I mean, your reset can be anything. And it doesn't have to be leaving the country. It could be, you know, taking a sabbatical from your work, or moving into a different place, a physical, different structure, where you're kind of basically upending all the ruts that you're in and doing something completely new. It changes your mindset. It changes your patterns. It increases your neuroplasticity, just change in general, and those are hitting the reset button. It can be the most powerful medicine you'll ever use.
Wow, I love that. That's amazing. Yeah, because you said something that really resonated with me. A few things. You were talking about all the pills, and I always had this joke. When you're sick with Lyme disease, you're always doing all this stuff, and the joke is always like the ceremonies take so long, which is like counting all the pills every night, so you have the whole fistful ready in the morning because you don't have 20 minutes to go through every bottle. Um, that was a big one. But you also are right. Like I love to read research. I love to be very scientific. But when you're sick, I remember I'd like, I'm not going to try one of these at a time. I'm going to throw all 72 of them in the mix. And if I feel better later, I can dissect which one. I'll start throwing 50 of them over here and 20 of them over there
Right.
and see which pile seems like it's doing something, sort of thing. But it's true when you're in it, you don't you don't care about scientific accuracy. You just anything to get to one step closer to that game is all that matters. So
Yeah.
we have,
Desperation is a huge motivator for experimentation when you're sick.
yes, it is. And so we have a lot of folks who use our products who are dealing with a lot of brain injury and brain illness, I'll call it. It's things for everything from Alzheimer's to CTE, concussion, Parkinson's, etc., and even stroke. Um, And so, is you from a neurosurgeon perspective, what does a healthy brain look like versus a diseased brain?
Yeah. So a healthy brain, let me start actually with a diseased brain. A diseased brain is atrophied. That means it's shrunk. And you can see this very vividly and clearly on an MRI scan and sometimes on a CT scan. The physical volume of the brain is smaller. Okay. You get these vascular insufficiency in the brain, an unhealthy brain, where most of the time it's just these, we call it small vessel disease, the small vessels that perforate the brain and feed, provide blood and oxygen and nutrients to the tissues of the brain. They get diseased and they essentially block off at very small terminal ends. And you get these little things called lacunar strokes all over the brain. That's very common in elderly. In fact, it's I would say most elderly people who get scans that I see have these little lacunar infarcts all over their brain. Um, the the hippocampus, which is this organ in the temporal lobes on both sides of your head, those atrophy, and that is your memory center.
Yeah.
That is where you integrate short-term into long-term memories. And in patients who are sick, even patients who are stressed, young patients who are stressed out, that hippocampus atrophies, and you can see that on scans. So that's, and there's a bunch of other factors. There's so many things that can make the brain sick. But when we're talking about, mild cognitive impairment or neurodegeneration from dementia, those are the kind of things we see. Now, a healthy brain is not atrophied. It's full. It fills the skull. There's no potential space left by brain atrophy. The vessels don't block off, and so you don't get these little tiny small vessel disease infarcts. And the frontal lobes, the temporal lobes, and the hippocampus, they're all nice and healthy looking. You see very good differentiation between gray matter and white matter, which are the two types of matter in the brain. And it's something you see in almost all kids. And as you get older, that health can degrade, but not in everyone. I would say there's a good contingent of the population who don't get that neurodegenerative progression. And those are people with optimal metabolic health when it comes down to it.
Got it. So key is metabolic health. And what sort of behaviors, is it genetics, I assume, partially, but also behaviors, I would assume?
Yeah, I mean, both, so genetics, there's something called APOE. It's it's a cholesterol transport protein. And there's three variants: APOE2, APOE3, and APOE4. So APOE2 is protective against dementia and neurodegenerative disease. APOE3 is neutral, and APOE4 has a propensity for Alzheimer's and neurodegenerative diseases. Yeah. And the reason it does is because the brain has 25% of all the cholesterol in your body is in the brain.
Wow.
Like 25% of all the cholesterol in your whole 180-pound body, whatever you weigh, is in the brain. And the brain weighs 2% of your body weight.
Yep.
And the brain is dependent on cholesterol. You cannot have a healthy brain without adequate amounts of cholesterol.
Yep.
And so people with APOE4 variants, they don't transport cholesterol well between the neurons in their brain. So how do they compensate? They compensate by increasing the amount of cholesterol production. And so people with APOE4 variants will often have higher cholesterol, like LDL levels, essentially. And that's not necessarily bad. And in fact, if you listen to my podcast or talk to me in person, I'm like, the first thing I'll tell you is I don't think high cholesterol is bad. It can be, but it's not necessarily bad. And it is not the cause of heart disease. It is a bystander. So let's just say this: when you get arterial disease,
yep,
if you do an autopsy in that patient, you open up the artery, you see cholesterol. So that 100 years ago, they said, "Oh, we see cholesterol in the arteries. Cholesterol must be causing a problem." Yep. And that is a very common thing to do in medicine. We still do it. In fact, we do it with Alzheimer's with these beta amyloid plaques.
Yep.
We see them there and we say, hey, cholesterol or these amyloid plaques are causing the problem. But they're actually, cholesterol goes into the artery to fix it.
Yeah.
It's a repair molecule.
Yeah.
Okay. So that being said, when you can't transport cholesterol very well between the neurons, you increase your LDL delivery system to try to get more cholesterol into the brain. Cholesterol doesn't cross into the brain very well. The brain has to make most of it, but it does that, and it also ramps up its cholesterol production in the brain. And that in itself can lead to a whole, if you're not taking care of your metabolic health, that can be basically a deleterious trait.
Yeah.
If you're not taking care of your metabolic health, because lipids oxidize when you're metabolically unhealthy.
Yep.
But if you take care of your metabolic health, then that high LDL level and that APOE4 variant won't cause you any problems. In fact, 80% of people who have, are heterozygous for APOE4, meaning they only have one copy of it, which is a lot of people, 80% of them never get Alzheimer's.
Yeah.
And for people who are homozygous and APOE4 means they have two copies, one from their mom and one from their dad, only 50% of them get Alzheimer's, which is very high, but still, that means 50% of people, they live a normal cognitive life. And it's because they're metabolically healthy.
It lowers the threshold for getting the disease, but it's not causal.
No. And so I would say anyone who knows their APOE status, because a lot of people check it, that is not your destiny.
Yeah.
Your APOE status. But yeah, that comes down to basically the genetic variants that you're asking about. That's the main one. There are other ones too, but that's the main one. And the other thing we were talking about were lifestyle, right?
That's right.
Okay. So there's a few things. Well, we talked about metabolic health. If you have diabetes, you're twice as likely to develop Alzheimer's. Twice as likely. Yeah. And if you have like metabolic disease, that means like you're pre-diabetic and you can measure that, check that by your A1C level. If you're pre-diabetic, you're 1.5 times more likely to develop Alzheimer's. And that's because you're metabolically unhealthy. And those type 2 diabetes and pre-diabetes are completely curable by anyone. That it's not I got this disease and I'm going to have to live with it. No, you don't even have to take a drug to cure it. I mean, drugs can help, but you can, like, within months, completely eradicate your metabolic sickness through diet and lifestyle changes.
Yep.
And most people don't know that. They think I got to go on this GLP-1 or I got to go on metformin, and yeah, you can do that, and those might help get you out of the hole, and then you can change your diet and lifestyle. But if you had none of that, I'm telling you right now, you don't have to have type 2 diabetes.
That's right.
The other big one for neurodegenerative disease is hypertension. In fact, if you have hypertension, you're 60% more likely to develop neurodegenerative diseases like Alzheimer's. And that all comes down to it's a sheer injury to the arterial walls, these small vessels I talked about in a sick brain. They get sheared and they get injured, and the cholesterol goes in to fix them. They end up getting blocked off, and you get these tiny little lacunar strokes in the white matter of your brain. So yeah, I mean, there's other things too, but diet, lifestyle, genetic factors, they all play a role, but they're almost all curable by changes in your behavior, and no genetic variant is your destiny.
Agreed. I was actually baiting you into it. I don't believe in any genetic destiny for the most part. There are some things, obviously. But when folks talk genetics, I was reminded of epigenetics is genetics, and that's the part of genetics that you can change, because the fact of the matter is the health of the body is dependent on the health of the spirit. Meaning, if you're in high spirits and you believe your body's going to do things that it can't do, if you're beat down and just say there's nothing I can do about it, like I'm predestined for this thing, then all of your behaviors and your immune system, everything kind of flows that way. And so I always think it's really important that people maintain hope when they're in a difficult health situation like that.
Yeah. I mean, I would say when I went to India, sold everything we owned. I mean, we had 3 cars, 5-bedroom house, a bunch of farm animals. We literally went to India, got rid of everything we owned, and went to India with 2 suitcases each in my family and our dog, and that increased the vibration or the height of my spirit. There's no doubt about it. It lowered my stress levels. It made me feel optimistic and free. And that transformed my health completely. It was crazy.
Actually, the most interesting thing you said there, I just learned, is that you can bring an animal across country lines. That's
it's very difficult.
But you had 4 kids, so you would have been in real trouble if you didn't.
Oh my gosh. Okay, and here, listen to this. Yeah, it was very difficult to take him. We came back with a second dog from India. Your kids. I promise, Dad, we're just gonna foster him, find him a home.
Yeah. Famous last words.
And next, famous last words, exactly.
Oh man. So is cognitive decline inevitable as we age?
It's not. Okay, so when you're in your 20s and you're at the height of your health and your vitality, it's hard to beat that, but there's something, as you get older, you have more wisdom. You might not have the synaptic potential that you have as a young person, at least not yet. Eventually we might get to that, but you have more wisdom. And so overall, you balance that out, and really, some of the most intelligent people out there that we hear talking are older people. They're not younger people, right?
Yep.
So that's that. As far as neurodegeneration, yeah, I mean, you can avoid cognitive impairment, and everyone knows this because they've all spoken to a 90-year-old who you're like, dang, that person's sharp, where they are just on it. And they're a minority, but that just shows that it can happen. And it's going to sound like a broken record, but that person likely had the genetic factors and the lifestyle factors working for them to keep their brain sharp. I have a almost 90-year-old grandmother who is as sharp as a knife. I mean, you give her math problems, she speaks multiple languages. I mean, she is just on it, and that's just how she's built, and she's lived a healthy, good life her whole life. And we all can be there, honestly.
Yeah, that's amazing. So obviously you've learned a lot in your journey and in your training and all of your experience in the real world. What health habits have you taken forward, and are you pursuing to keep yourself healthy and have good vascular and mitochondrial health?
Yeah. So I would say the number one thing, I would say, after you de-stress, I mean, you can't live a life, you can't be healthy being chronically stressed. I'll just say that. And if that's your life, you need to make the change, because no matter what you do, you're not going to climb out of the hole if you're constantly pushing yourself deeper into it. So you got to figure out some way. There's meditation, there's lifestyle adaptations, and cognitive behavioral things you can do. But like I said, oftentimes you need to hit the reset button. That might mean you have a financial injury, or you lose some time that you wanted to progress in something else. But in the long run, you'll be so much better off. You'll do so much better by just reinventing your life so that it's not a stressful one. Now, I know some people might have very unique situations that they can't really, that makes it difficult, but there's usually a way. Be creative.
Even within your envelope, you can find a way to have less stress. I always say, right? Perfection is the enemy of progress.
Exactly. And the other thing is that there are adaptive techniques you can use, like meditation can be very helpful. I mean, even if you're skeptical about all this stuff, and I was the most skeptical person ever. Meditation is amazing if you do it right. So that's definitely something you can try. So once you've de-stressed, you're not pushing yourself further and further into the hole. Exercise is the number one, by far, best thing you can do for your neurological health. In fact, so the studies generally say about 150 minutes a week of exercise is optimal. And if you do this, it increases brain volume significantly. In fact, they've taken older patients who are suffering with mild cognitive impairment, and they put one group on exercise routine and one group on like a stretching routine. And the ones who were doing aerobic exercise, they were just walking for 20 minutes a day. They had a 2% increase in the size of their hippocampus, which is huge.
Yeah.
Over 2 years.
Wow.
And the other group that was just stretching had a 1.4% atrophy of their hippocampus.
Wow.
Yeah. And I know you know this, Brad, and your audience probably knows it too, but exercise increases blood flow. It dynamically increases blood pressure when it should be increased.
Yep.
It improves metabolic health. It reduces inflammation. It does all these things. Like, it's almost like if you could put exercise in a pill, it would be the best selling drug ever invented.
Yep.
But you can't, right?
Right.
And that's awesome, because everyone can have it. Everyone can do exercise. It's free. It has no side effects. And it's the best thing you can do for your neurological health. In fact, no centenarians, there's no group of centenarians out there that weren't very active throughout their lifestyle.
That makes a lot
so I'd
of sense.
say, aerobic health is the best thing you can do. And weight training is second, and it's very important too, I think, to prevent sarcopenia as you get older. But all these things exercise tops the list by far.
So de-stress, exercise, some meditation. Yeah. That's great. That's great. Well, hey, Ravi, I really enjoyed having you on the podcast. I learned a lot today, and thank you for taking the time to join us.
Yeah, it was my pleasure, Brad. Thanks for having me.